Hello, my name is Dr. Sudit Ranade, and I'm the Medical Officer of Health for the County of Lambton. Today I'd like you to join me in having a very important conversation that's part of a national conversation around intimate partner violence and COVID-19. During the pandemic, we've been asking people to stay in their households, but sometimes your household is not a safe place for you. And if that's true, we want you to know that you're not alone and that there are supports in the community that are available to you. Please join me in welcoming Angie Marx, who's the Executive Director of the Women's Interval Home in Sarnia.
Hi there.
Hi. Thank you for joining me.
Thank you for having me.
Angie, can you tell us a little bit about what's happening in your organization to respond to the needs of people who are facing intimate partner violence during COVID-19?
Absolutely. So certainly our service model required some shifting in order to maintain both the health and safety of our service users, women and children, and our staff. So we quickly created a secondary location where we're able to send lower risk women to be housed there. We have a security guard who assists in maintaining the safety that our women require when leaving an abusive relationship. And then in this, our actual shelter, we have some rooms dedicated for high-risk women and children, as well as a quarantine room, should any woman present with symptoms. And then we would, certainly get the medical needs that they require. But we wanted to ensure that our services were meeting the necessity to socially distance or physical distancing is being provided, but also ensuring that women have a very comfortable space. We're very fortunate that our community, so Imperial Oil, their WIN committee has donated craft boxes and activities to have in their rooms. We're very fortunate to have some funding that assisted us in providing TVs for the rooms so that they have very comfortable settings with the reduction of our shelter communal areas. Staff have really worked hard, and we've been very innovative and creative in the food, the way we have to deliver the food, both to the secondary location and at the shelter. So it was a lot of learning, but it's really working effectively.
Great. How would you recommend that people get in touch with your organization if they need to?
We are open through email, so info@, Women's Interval Home, or by calling our direct number, 519-336-5200. And when we refer to people, I think it's really important to recognize that with the isolation, I call this sort of a dream gift for an abuser, because one of their biggest tactics is to isolate a woman from friends, families, and supports. And what we're hearing is that, even the COVID-19 symptoms are being used as tactics to maintain children, friends, and family away from a woman. So saying that the woman may have these symptoms. So when we talk about people who may need to contact us, this could be the woman herself who's experiencing the abuse, but also friends, families, and neighbors. I think it's really important not to forget the concerns that you may have had prior to isolation, and know that if you do have concerns about a woman who is now being isolated in a home that you were worried about previously, to ensure that you're calling. So through them, we can provide awareness, education, some safety tips to be able to send those messages to a woman who's being abused. As simple as doing constant or continuous check-ins via phone and asking very closed-ended questions. Are you safe? Do you need me to call the police? Do you have a bag ready if you need to escape? Do you have an escape plan? We can do some preparation for an escape safety plan through a member of the family who might be concerned about that family, about that specific woman who may be experiencing abuse.
And are there any other ways that you would recommend somebody who might have a concern about a friend or family member? Any other tips or things that you would recommend for them to do?
The biggest thing is to really stay connected. Unfortunately, when I think about the safety planning that we would typically do with a woman, it's very difficult. So things like if talking, reporting to a neighbor or making sure somebody knows about her abuse. And now we're impacted with privacy issues, access to phone, being able to leave the house. Those pieces have been removed. So really it's about the friend, the neighbor, the family to just continue to check in with her, whether, she has an email, directing her to change passwords at this time, working on codes, even on a Facebook page. It's not unusual for a woman to be on Facebook, but maybe through a simple call, if she says, hey, if I post a picture of, I don't know, Smurfette, I need your help. Just to develop some of these codes. And also to let them know that it's okay to tell the children, if there's children in the house, that the mother has a private conversation with the child to let them know that the abuse is not their fault, but they need to maintain their safety should a violent episode occur. And make sure that they have clear instruction, that they have access and know how to use a phone to call for help. Again, another code word for the kids. If mommy yells monkey, I need you to call 911. So alerting those children. Children not going to school leaves me very concerned. Children's safety net could have been their school. Going to school and having a trusted adult, which is another support that has also been removed from them, and potentially a lot more greater exposure to the domestic violence that's happening in the home with the abuser being home 24/7.
Thank you so much, Angie, for the work that your team and you are doing in general, but also especially through COVID-19. We really appreciate it, and I hope we can get the word out about where to get supports for people if they need it.
I really appreciate this opportunity. I'm really thankful that we have another means for us to reach out to our community, to let them know that we are open and we are available. And at any rate, even if you call and say, send a cab with an address, that's all we need to know. We will do the work from there. But if you are in great trouble, please call 911. The police are also there to deal with these types of domestics, as we are anticipating a greater surge, and we're hearing that the intensity and the severity of the abuse is rapidly increasing.
Thank you again, Angie.